Makena Vial is used in pregnant women who have previously delivered a baby too early. It helps lower the risk of having a preterm baby again. This medication contains a man-made form of a hormone called progestin. It is not known exactly how it works to prevent preterm births. It is important to note that Makena Vial is not intended to prevent preterm birth in women pregnant with more than one baby, such as twins or triplets. It is also not meant to stop active preterm labor. The recommended dosage is typically once a week, and the optimal time to take this medication is determined by your healthcare provider. Before using Makena Vial, make sure to read the patient information leaflet from your pharmacist. This medication is given by injection once a week, either under the skin of your upper arm or into the muscle of your buttocks. You will start receiving injections between the 16th and 20th week of your pregnancy, and continue once a week until week 37 of your pregnancy or when your baby is delivered. It's important to use this medication regularly to get the most benefit from it. Some common side effects of Makena Vial may include pain, swelling, itching, bruising, or a lump at the injection site, as well as nausea or diarrhea. If these effects persist or worsen, notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. However, it's important to seek medical attention if you experience any serious side effects such as persistent nausea/vomiting, dark urine, changes in mood, abdominal pain, unusual vaginal bleeding, or yellowing of the eyes or skin. In rare cases, this drug may cause blood clots, so seek immediate medical help if you experience symptoms such as chest pain, confusion, or sudden shortness of breath. Although rare, a serious allergic reaction to this drug is possible. Seek immediate medical assistance if you notice symptoms such as rash, swelling of the face/tongue/throat, severe dizziness, or difficulty breathing. This is not an exhaustive list of possible side effects, so it's important to consult your doctor or pharmacist if you notice any other effects. If you're in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Before using Makena Vial, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have asthma, blood clotting problems, cancer, depression, diabetes, heart problems, high blood pressure, kidney or liver problems, seizures, or any unusual vaginal bleeding. If you have diabetes, it's important to monitor your blood sugar regularly and inform your doctor of any changes. Makena Vial is used to prevent preterm birth during pregnancy, so be sure to discuss the risks and benefits with your doctor. Additionally, if you are breastfeeding, consult your doctor before using this medication, as it may pass into breast milk. And before undergoing any surgery, make sure to inform your doctor or dentist about all the medications and products you are using. When taking Makena Vial, it is important to be aware of potential drug interactions that could affect how the medication works or increase the risk of experiencing serious side effects. It is important to keep a comprehensive list of all the products you use, including prescription and non-prescription drugs, as well as any herbal products, and discuss this list with your doctor and pharmacist. It is crucial to follow your doctor's guidance and not make any changes to the dosage or start or stop any other medications without their approval. This will help ensure the safe and effective use of Makena Vial. Remember to always consult your healthcare provider for personalized medical advice. If someone has taken too much Makena Vial and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help. In the US, residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important to keep all of your medical and lab appointments when taking Makena Vial. This will help your healthcare provider monitor your progress and make sure the medication is working effectively for you. Remember, it's crucial to take Makena Vial exactly as prescribed. If you happen to miss a dose, make sure to consult your doctor or pharmacist to arrange a new dosing schedule. This medication, Makena Vial, is administered in a medical setting such as a hospital, clinic, or doctor's office, and is not intended to be stored at home. It is used to help reduce the risk of preterm birth in pregnant women with a history of preterm birth. The dosage and timing of administration will be determined by a healthcare professional based on individual circumstances. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.